In this video, I'm going to tell you how you can use the SBAR techniques when we are communicating with the doctors or any other healthcare professionals. Firstly, you have to identify yourself, who you are, from where are you calling, and which patient you're gonna be call about. Situation means what is the major concerns related to the patient. What is the happening at the present time? Like firstly, we're gonna be identify ourselves. We're gonna be tell our name. We're gonna be tell our status. We're going to be identify the location where we are calling from, identify the patient's name, date of admission, and diagnosis. Sometimes when we are identifying the patient's name, always doctors is asking MRN number. So we always give the patient's MRN number because that is the unique identification number of the patients within the hospital care setting, because there are a lot of patients who are having the same names as well. And then we're going to be identify the reason of our calling, like patient is having this symptom and I'm concerned about this one. So then we're going to be use the background information of the patient, like what are the circumstances left leading up to the situation. We are going to be identify significant medical history and any problems with the current situation, because we are calling for the current situation. And we always identify any allergies, any patient lab data with that date and time. And then is the assessment. We always do what do I think is the problem. Like when we are going to be check the patient, if there is any symptoms of the patient, then we're going to be just do the vital signs check, like temperature, blood pressure, heart rate, respiratory rate, and we're going to be check the oxygen saturation of the patient. What are the baseline changes? That means if we did any procedure or we give any medication to the patient, before that what's the vital signs of that patient. Going to be just conclude all the clinical impressions and concerns. I think the problem is that. I think the problem is this. So this is our assessment that we have done before calling the physician. Last one is the recommendations. What do I recommend that we need to do? Like identify our request, like time frame. What I need from you is this one. If the patient is having pain, can you please prescribe any pain medication? This is my recommendation that other non-pharmacological interventions failed and I need a painkiller for that patient. If there is any critical situation arises, then we're gonna be told the doctor, we need you here. Like I need you to see the patient. That is our recommendations as per the patient condition. Thank you so much for watching this video.